Now at 6, another star athlete suffers cardiac arrest.
LeBron James' son, Bronny, recovering tonight.
This is an elite athlete, someone who's in very good shape, who's used to physically pushing themselves.
News 5 following through with our ongoing conversation about heart health, particularly in young athletes.
It's insane that we don't have awareness that these symptoms could be concealing a heart condition.
What's being done here in Ohio and nationwide to save lives.
Experts say it happens 100 to 150 times every year. A competitive athlete suffers cardiac arrest.
You may recall it happened 7 months ago when Buffalo Bills star DeMar Hamlin collapsed on the field during a game. And now it's happened to an up-and-coming basketball star and the son of one of the best to ever play the game.
Yeah, Bronny James suffering cardiac arrest during practice at USC last night. LeBron's eldest son is out of the ICU tonight. The family thanking the USC medical and athletic staffs for their incredible work.
Now, the push for heart health awareness has been taking place in Ohio for years, and News 5's Nadine Abusada begins our in-depth coverage tonight.
The importance of a healthy heart is crucial in everyday life, but for athletes, it's especially important.
Anyone, no matter what age, no matter what activity level, could be concealing a heart condition.
On Monday, LeBron James' son, Bronny, suffered from cardiac arrest during basketball practice at USC. Though his condition is now stable, we don't know what caused his arrest. Dr. Judith Mackel, cardiac electrophysiologist at University Hospital, says it could be a number of things.
In young and old people, sometimes the reason that the electrical system gets out of whack is because of a structural issue, but sometimes, especially in young patients, it's a primary electrical problem.
If an athlete does have a heart condition, the two most common are abnormal coronary artery flow, or
the commonest one in the United States is a condition called hypertrophic cardiomyopathy, where the heart muscle gets abnormally thickened.
Though a cardiac arrest is usually very sudden, athletes can still take steps to protect themselves.
Paying attention to warning signs, knowing your family history.
Which is why heart health activist Lindsay Davis.
There's 72% of the children that are collapsing are reporting these symptoms, and everyone is misdiagnosing them.
Has pushed for Lindsay's law that was established in 2017. Now, parents, coaches, and athletes must watch a video that educates them about heart health, preventative measures, and what to do in times of a cardiac arrest.
And they're supposed to sign off on a form saying they understand the symptoms of a heart condition, and if they feel any of those, they'll tell someone.
They are also pushing to change the law to require AEDs in schools. The American Heart Association says if a patient receives defibrillation through an AED in the first minute, the survival rate is 90%.
In the NCAA, we have all of these in place, but that's why we're fighting so hard to get these protections in place for high school student athletes, because one group should not be more important than the other.
Dr. Mackel also says athletes can still play with heart conditions, but that decision is up to the athlete, their doctor, and their coaching staff. Reporting in Cleveland, Nadine Abusada, News 5.
Now, that change to Lindsay's law Nadine mentioned is House Bill 47. It would mandate AEDs at schools and rec centers in Ohio. The State House passed it earlier this year. It's now in a Senate committee. While having AEDs on sidelines of school sporting events are recommended by groups like the Ohio High School Athletic Association and the National Center for Catastrophic Sport Injury Research, they are not required in Ohio. It's also a push to put AEDs in schools nationwide. DeMar Hamlin joined lawmakers when they introduced the Access to AEDs Act earlier this year. This would require grants to promote access to defibrillators in elementary and secondary schools. That bill is sitting in a Senate committee with a companion resolution right now in the House.
And then there's knowing about the risks. The American Academy of Pediatrics recommends that all children be screened for conditions that can lead to cardiac arrest starting in middle or junior high, regardless of whether or not they're athletes. Now, the screenings are made up of 4 questions asking if a child has ever fainted, had an unexplained seizure, experienced chest pain or shortness of breath, or have a family history of cardiac conditions or death before 50. Now, you can check out all of our stories on the ongoing in-depth coverage on heart health on our website. That's news5cleveland.com.
Wow, no doubt, scary stuff. Wow.
It really is.